1000 words, part 3. This time, health and illness. Hey guys, this is P. English 1, your free English classroom. Okay, so this time with each word, okay, we have pronunciation, key collocations, this is new, and real life examples. But let me tell you, what is a collocation? Collocations are the words, okay, that normally come together. Okay, I'll give you some examples, you will understand. So as you can see, health and illness. So the first word, okay, which is word 21, is health. Health. Okay, look at the last one, health. Okay, this sound is very important, meaning it's a condition of your body. Okay, your body or your mind, whether your body or your mind is healthy. Okay, let me write something here, healthy or unhealthy. Okay, I told you something, health is a noun. Okay, so healthy is an adjective. We cannot use them, okay, like in wrong places with different part of speech. For example, health is one of the most important things in life. Okay, you cannot say I have a health body because it's not an adjective, so you should say I have a healthy body, a healthy body, or a healthy mind. When someone is in good health, okay, their body and mind are working well, in a good way, well, okay. So these are collocations, when or how we use health. Okay, for example, a good health, as in here, when someone is in good health. Okay, being healthy and strong. In bad health, in good health. Okay, I'm not in a good health. Okay, and when you improve, you make it better. Okay, make your health better, improve your health. Like, what can you do? Okay, what can you do to improve your health? You can work out, right? You can ride bikes. I don't know. You can, let's say, go on a diet. Yeah, you can improve your health in different ways. And health problems, this time it's negative issues that affect your well-being. Okay, they affect your health or health problems. We'll talk about it. Okay, so these are some common collocations. Let's talk about examples, some real life examples of health. So one example sentence is this: good good health is important for a happy life. Yes, that's right. One more time. Good health is important for a happy life. Okay? And exercise, okay? As what let's say this young lady is doing in the picture. Exercise can exercise can improve, okay? Can improve. Look, can improve your health. Yes, that's right. Okay? There's two examples. So word 21 was health. Let's take a look at the next one. This time, oh my god, what is wrong with, let's say, with this guy, right? With her. It's ill. Okay, the stress is on the first syllable. Illness. 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 Okay? Meaning, it's a problem. Okay? That makes you sick. Or you can just say sickness. Okay? When you're sick, you have an illness. An illness can be mild, okay? Neither, let's say that, bad nor good, or serious, like something serious, something bad, right? And it can affect different parts of your body, right? So that's an illness. Some collocations of illness. Okay, when you're ill, okay, let me write it down. Ill, okay, or sick. They're sort of the same. Okay, a serious illness, a mild illness, a severe health problem, a very bad health problem is a serious illness. When you like in a situation with illness, you suffer from it. Okay? To be sick with something, I suffer from an illness. Okay? It's like struggling with it. To be sick with something. He is suffering. Okay? Like he is in pain. Something like that. From. This is the preposition. Okay? We use suffer from an illness. And when you get better, it's like you recover. Okay? You recover from an illness. Okay? You get better. So suffer is the situation you're at, okay? And recover is when you get better, okay? Like safe and sound. Good. So some examples. She had a serious illness last year, but I guess now she is fully recovered, okay? Some illnesses spread, okay? Spread quickly. Like they go to different parts of your body. Some of them, yes, they spread quickly. They become bigger and bigger every day. Some illnesses spread quickly. Okay, good. Oh my god, this one is bad. Okay, like this guy is suffering. Okay, he or she is not healthy, so he or she is in pain. Pain. Okay, a feeling that hurts in your body. Hurt. Okay, pain can be sharp, okay, dull, or throbbing, and it can happen anywhere. Yes, your head, your arm, right, your hand, your heart, your lungs, I don't know, yeah, upper, lower part of your body. And some collocations of pain is like I feel pain. This is the verb. I feel pain. It's like I'm experiencing. Okay, when you experience hurting, it's I feel pain, or I have pain. Okay, or I'm in pain. To be experiencing discomfort is I have pain. Okay, in my chest, for example. Reduce pain, okay, to make the hurting less this time. Okay, reduce pain. We'll talk about some ways of reducing pains. Okay, some example sentences. I have pain in my back, as in the picture. I have pain, or I feel pain in my back. Okay, the medicine helped reduce the pain. Okay, the medicine, something you take normally, okay, helped reduce the pain. Good. Next, we have, okay, this is the first one, fever. Fever, okay, like this, something is wrong in this picture, and it's a body temperature. Okay, when it's high, when you're sick, it's high, right? Your body temperature. A normal body temperature is around 98.5. I think this is Fahrenheit, or 37 Celsius. Okay, when it goes higher, you have a fever, higher than, let's say, normal. Okay, the normal temperature, and it's like you have a fever, you're sick, a high fever. Okay, fever goes down. Okay, sometimes it can be very risky, it can be very dangerous. I have a fever today. Okay, his fever went down. Okay, going up and down, went down in the past after taking medicine, whatever it is. Okay, good. And the next one is cough. Okay, Cough. A sudden sound when air comes out of your throat. This is coughing. It's your body's way of clearing your airways. Okay, your airways. Like having a fever, it's like you have a cough. A bad cough or a dry cough, which is, let's say, the most awful. Okay, a dry cough. I have a bad cough. Okay, so I can't go to work today. Or her cough got better after a few days. Maybe she took medicine. Okay, so fever and cough. This is about temperature, high temperature, and this is about, yes, like clearing your airways. Okay, what I did. And sixth, okay, headache. Headache. It's a pain in your head. So this one is important. Normally, okay, we use this word, the stem, to show, let's say, one body part with pain, like headache, like toothache, okay, like stomachache, okay, stomachache. So don't read this as H, like stomach, okay, stomachache, okay. Pain in your head. Headaches are very common. Yeah, they are. Okay, and they can be caused by stress. Yeah, that's one of the reasons. Lack of sleep, when you don't sleep enough, or illness. Yes, like a health problem, right? I have a headache. To feel pain in your head, I have a headache. I have a stomachache. Okay, to start feeling the pain, I'm getting a headache. I got a headache yesterday. Get a headache. And a terrible headache. A very strong headache. Okay, some examples. As you can see, oh my god, I have a terrible headache. Like this guy. Okay, this guy has, right? It's he. He has a terrible headache. Or she got a headache after working all day. Yeah, sometimes like working too much will like make you, right, in a bad situation. So you get a headache. Yes, this was word number 6. The next one we discussed, okay, we talked about this word. It's, look, the stress is on the first syllable. Medicine. Medicine. Okay, these are all medicine, something you take. So we say take medicine. Okay, so to treat, okay, to treat an illness, what you do with an illness is like treating the illness. Medicine can come as pills. These are pills. Okay, liquids. Okay, sometimes, or injections. Okay, they inject it to your body, and it helps your body fight sickness. Okay, and it's necessary again to, let's say, fight the sickness, to treat an illness, and to take medicine. Okay, so collocations: to take medicine, to swallow, okay, or use medicine as like directed by a doctor, or let's say, yeah, prescribed by a doctor. Medicine for pain. Medicine used to reduce or stop pain in the body, like painkillers. A strong medicine, powerful medicine used for serious conditions. Okay, the doctor gave me some medicine. I went to the doctor, okay, and he gave me some medicine. Take your medicine after eating. Take your medicine before eating. Okay? It's still taking. Okay? Taking. This is the most important collocation for medicine. Take medicine. Good. The next one is symptom. Okay? Symptom is the sign. Okay? The sign that normally, okay, how can you recognize, how do you know you're sick? By symptoms, right? You have pain in your stomach, in your head, I don't know, anywhere. So it shows you may be sick, and then you go to the doctor, right? Symptoms help doctors understand what is wrong with your body. Yes, that is correct. Some, let's say, collocations are a common symptom, a sign that many people experience. For example, a common symptom is headache, right? Show symptoms to display signs of being sick. Okay, and have symptoms. Do you have okay? Do you have what let's say symptoms do you have? To experience signs of illness. Okay, some examples. A headache can be a symptom of stress. Okay, or let's say something more serious. Tell the doctor about your symptoms. Or I'm the doctor, I ask you, tell me about your symptoms. Okay, so yes, this is the word. And yeah, this time, okay, last two words are, okay, take a look. The stress is on the second syllable this time. We don't say recover, we say recover. Recover. Okay, like this lady is recovering. Okay, to become healthy again after being sick is recovering or recovery. Recovery time can vary. Okay, it may be different. Okay, vary is a verb, depending on the illness. Okay, sometimes it takes you, I don't know, a week, sometimes a month, sometimes a year. Okay, and so it vary. Okay, it may be different. Recover quickly to get better fast. Sometimes, yeah, you don't fully recover. Yeah, maybe for for years. Recover from an illness to return to health. Okay, and to be completely healthy again is fully, completely recover. Okay, like she recovered quickly after the operation. Okay, and um, it took him 2 weeks to recover from the illness. Normally, for like, let's say how long it takes. Okay, we say it takes you, or it took me. It took me 2 weeks. Okay, to do it. For example, we talk about the length. Okay, of the activity. And the last word will be treatment. Okay, treatment. Something done to help cure an illness or injury. Treatment can include medicine. Okay, it's the process or the things that will help you recover. It's treatment. Medicine, therapy, different operations. So we call it surgery. Okay, so medical treatment, care given by doctors. Yes, that is medical treatment. You receive treatment, right? To get medical care is receiving it. And treatment for a disease, for an illness. Okay? Care for a specific illness is treatment for a disease. Two examples. The treatment was successful. Okay? And he started treatment last month. Okay? And yes, let's just have a quick review. Okay, how with some, let's say, fill in the gaps. Okay, so I'll wait a couple of seconds for you to reply, okay, or to give me the answer. So, number one, exercise can improve your. Okay, thank you. If you said, yes, one more time, exercise can improve your health. Good. Number two, I have a high temperature. I have a, or together, I have a. Thank you, I'm sure. Okay, the answer was correct. Good. I have a fever, right? Good. My throat, my throat hurts. And I have a bad, when your throat hurts, you have a bad, you may have a bad cough. Thank you. Yes. The doctor gave me some advice. No, not really. Sometimes they do, but this time it's different. Yes, the doctor gave me some medicine. Good. Number five, a headache can be something of stress, a sign of stress. What is another word for sign? It's symptom, right? Good. She was sick last week, but now she is starting to feel better. Or, yes, thank you, recover. Good. Now speak in practice, okay? These are open-ended, okay? Just respond, okay? Whatever you want to say. It doesn't matter. I mean, question one, what do you do to stay healthy? You can because it's a routine, it's a habit. You can use present simple like I run, I exercise, I swim, I walk. Okay? And etc. Try to write it down, okay? It will help you a lot. Writing is something else. It's completely different. What do you do when you have a headache? Mm-hmm. Do you go to sleep? Do you take medicine? Painkillers? Good. And have you ever recovered from a serious illness? No. Okay. Yes. What was it? Can you tell me about it? Well, guys, thank you for watching. Okay, thank you for your attention. This is English 1, Part 3, 1000 words. Okay, this time health and illness. Don't forget to subscribe, to like the video, okay, to leave a comment if you have any questions, anything to say, and share this video to your friends. I'll see you next time. Have a great time. Goodbye.